Hey everybody, this is Alan Dubberley, Marketing Manager for Sheridan Memorial Hospital, and we're here with Dr. John Addlesperger, Chief Medical Officer for Sheridan Memorial Hospital. Hey Doc, thanks for joining us today. Tell us a little bit about what's going on with the hospital's vaccination program.
Sure, Alan. We received a shipment of Moderna vaccine last Wednesday and began vaccinating. Within an hour, we started vaccinating our direct patient care staff and physicians and providers. We were able to get 40 people done by Wednesday afternoon and started again on Christmas Eve, and we're able to do another 50 or so. We continue on this week vaccinating that group of people that have exposure to patients, to testing collection, to specimen samples, all those people that are higher risk of contracting COVID-19 are being immunized first, and then we're moving throughout the hospital and other areas where people have an increased risk because of the work they do in the hospital. We're hoping to have the hospital staff immunized in the next week or two and be able to move on then to starting with some patients. There are vaccinations that are happening in the community for essential workers. We work with the county public health department to meet the priority list of the state. So we're going through healthcare workers, essential workers first, and as soon as we get that done, we can move into phase 1B, which will also be some essential workers. And then we anticipate that when the state priority list comes out, it will indicate that we can start with 70-year-olds and start immunizing those people. They're obviously at the most risk of having serious disease and mortality, so we're anxious to get that started. We're working on a program now to be able to do that safely and efficiently here at the hospital.
So is there a timetable for when the public can expect to be notified about vaccinations available to them?
We hope to be getting information out based again on this new priority list. When we see that, hopefully that's going to be out on Friday. That will help us determine how we're going to get in contact with people and how we're going to do that. We'll be releasing phone numbers where people can call in and get on a list for that priority that we're doing at that time. So it's probably going to be, again, another week and a half or two before we start doing patients.
All right, Doc, appreciate your time today, and we'll look forward to updates in the future.